Welcome in, everyone. Today we're taking a deep dive into the world of telemedicine. Specifically, we're going to be looking at how older adults feel about using it. It's easy to think of telemedicine as this win-win for everyone, this like perfect blend of technology and healthcare.
Right. It's definitely been presented that way, especially with how much it took off during the pandemic.
Exactly.
But like with any new healthcare tool, I think we need to look beyond that initial excitement and really delve into the actual patient experience,
Yeah.
to get the complete picture.
Absolutely.
Hmm.
And that's exactly what we're doing today. We're diving into this really interesting research paper titled Patient Perspectives on Telemedicine During the COVID-19 Pandemic, a mixed methods community-based study.
Mm-hmm.
And this isn't just any study, right?
Yeah.
This comes from the well-respected Rotterdam study.
Yeah.
They're known for their very thorough long-term research.
It's a very significant piece of work, and they didn't just look at numbers like a typical quantitative study. This study uses a mixed methods approach. So they combined this large survey of older adults, but then also did some really in-depth analysis of individual responses.
Oh, wow.
So you get that crucial why behind the what.
I see. Okay. So we're going beyond just the surface level here.
Exactly.
Instead of just saying, yeah, older folks use telemedicine, we're trying to understand, like, how they felt about it,
Yeah.
especially during those, early pandemic days. And it's interesting because the study title even mentions older adults specifically.
Right.
And there's this, I don't know, maybe assumption that older generations might be less comfortable with technology, so it makes their experience even more valuable to understand, I think.
Absolutely. And, one of the things that I found most fascinating about this particular study is that it wasn't like a universal love fest for telemedicine. Nearly half of the older adults that they surveyed actually preferred in-person visits.
Oh, wow. Really?
Yeah, which I think really challenges that kind of dominant narrative that everyone just loves the convenience of virtual appointments.
Yeah, for sure. It really does. And it makes you think like, okay, if it were just about convenience, you would think those numbers would be way more in favor of telemedicine.
Exactly.
So there must be something deeper at play here. Like, what is it about those in-person visits that we're not quite capturing virtually?
That's the million-dollar question. And, the study offers some really compelling clues. One of the recurring themes was this idea of nonverbal communication in a healthcare setting.
Oh.
It's something we often overlook, but
Totally.
if you think about it, a doctor's subtle frown when they're explaining something or a reassuring nod, those little cues can totally change how we interpret what they're saying.
Oh, absolutely.
And the study participants really echoed that sentiment. They talked about feeling this sense of disconnect during these virtual visits, like this lack of that personal connection, not being able to fully read the doctor's body language,
Right.
made it really difficult for them to fully grasp what was being said, to build that trust, to really understand their diagnosis or treatment plan.
That makes a lot of sense. I can imagine trying to decipher, serious medical news from someone on this tiny little screen.
Mm-hmm.
You've only got their facial expressions to go by. You definitely miss those subtle cues that you get with like a physical presence, right?
Yeah.
And it makes you wonder, like, how much do those nuances actually influence our understanding and comfort during a doctor's visit?
I think it speaks volumes about how important that human element is in healthcare.
Yeah.
It's this aspect that sometimes gets lost in this pursuit of technological advancement. And it wasn't just about the communication piece. It also seemed like this disconnect fueled a lot of anxieties around, like, diagnosis accuracy.
Oh, yeah.
Many of the participants question whether a doctor could truly assess their condition remotely without that physical exam.
Oh, I could totally relate to that. That feeling of like, can you really diagnose that through a screen? Like, it's real.
Right.
It makes you wonder, about the limits of what technology can achieve in terms of replacing that in-person interaction.
Yeah, for sure.
Like, it's one thing to have a video call, but it's another to have someone like actually there with you.
Exactly. And the participants were very vocal about missing that reassurance of having the doctor physically examine them,
Yeah.
like listening to their heart, checking their reflexes, all those things that we kind of associate with a thorough checkup.
Right.
And I think there's a certain comfort in that physical touch, that sense of being carefully examined, which is really hard to replicate through a screen.
It's not just about getting the information, right?
Mhm.
It's about that whole experience of going to the doctor.
Yeah, that ritual.
That feeling of being examined and cared for. But It wasn't all negative, though, was it?
Oh, absolutely not.
The study also found situations where these older adults, really liked using telemedicine.
Yeah, absolutely. And I think it's important to highlight the positive,
Yeah.
One area where telemedicine really shined was convenience, you know? Think about it. For people who maybe have mobility issues, for them, just getting to a doctor's appointment can be like a whole ordeal.
Yeah.
Telemedicine removes all of those barriers,
Oh, for sure.
and it makes healthcare much more accessible.
Absolutely. And even for those of us who don't have, mobility challenges or anything like that,
Yeah.
let's be real. Sometimes the last thing you want to do when you don't feel good is schlep yourself to the doctor's office.
Right.
You've got to deal with traffic, parking, waiting rooms.
Oh, no.
It's like suddenly that video call from your couch is sounding pretty good.
Exactly. And that convenience factor, it actually goes beyond just physical limitations.
Okay.
The study found that people often preferred telemedicine for their follow-up appointments,
Right.
or for routine check-ins, or if they just needed to discuss test results.
Okay.
Essentially, situations where a physical exam may not be strictly necessary.
Yeah, that makes sense. Like if I just need a quick prescription refill or something,
exactly.
or if I'm just getting the results of like a blood test or something.
Yeah.
A virtual visit just saves everyone so much time and hassle.
So much.
And sometimes, you just want to connect with your doctor quickly without having to deal with the receptionist and like a packed waiting room.
Yeah.
So it seems like telemedicine offers this great alternative for those like kind of more routine interactions.
It does. It really does. And it kind of leads us to a really, I think, crucial insight from the study, which is this idea of the importance of personalization in healthcare.
Okay.
Just as we all have different communication styles, and different comfort levels with technology, our preferences for like virtual versus in-person care, they're going to naturally differ.
Oh,
It's
sure.
not one size fits all.
Totally. We're all unique snowflakes.
Yeah.
It's about like, finding that sweet spot, the
Yeah.
right balance between all the cool things that technology can do, but then also, the very real human needs of patients.
Right.
It makes me think that maybe the future of telemedicine is really about making it more personalized. I mean, we personalize everything else in our lives these days, right?
That's right.
Why not healthcare?
It's exciting. Just imagine like a system where doctors are specifically trained in virtual communication techniques.
Yeah.
So they're learning how to really build that rapport and convey empathy through a screen.
Interesting.
Or we might see a rise in these like hybrid models
Oh, okay.
that seamlessly blend virtual and in-person care based on, the patient's needs in the specific situation.
Yeah.
What do you think about that?
Oh, I think that's fascinating. Like imagine, for example, you could start with a virtual consultation,
Right.
just to kind of discuss like your symptoms, get the ball rolling.
Yeah.
But then if you actually need that physical exam,
Yeah.
you seamlessly transition to an in-person visit. So you kind of get like the efficiency and convenience of telemedicine at the beginning, but then when you really need it, you have that reassurance and that personal connection of a face-to-face interaction.
It is really the best of both worlds.
It really is.
And I think it also empowers, the doctors to kind of use their skills and their expertise in the most effective way possible, right?
Totally. Yeah.
Because after all, some physicians might just thrive in that virtual setting.
Yeah.
They might develop communication styles that are just uniquely suited for it. It's about, playing to everyone's strengths.
Oh, that's so smart.
Yeah.
I love that. But, before we get like too far down that road and start planning the future of telemedicine, I want to come back to this study for just a minute.
Yeah.
Because one thing that really struck me was how different all of the experiences with telemedicine were, even within this older adult group,
Yeah.
It really challenged those assumptions we were talking about earlier about older adults and technology.
That's such a vital point. You can't simply lump everyone into these broad demographic categories and then assume that all their needs are the same.
Exactly.
Age is just one small piece of a much bigger, much more complicated puzzle.
Absolutely.
To assume that every older adult dislikes or struggles with technology, it's not only inaccurate,
Yeah,
it's a real disservice.
I totally agree. And, it makes me think about all those other generalizations we make about people all the time, right?
Yeah.
Like, all millennials love avocado toast, or boomers can't work a smartphone.
Right.
Those might be good for a laugh, those stereotypes, but they never really reflect the actual complexity of real people, especially when we're talking about something as personal as healthcare.
That's exactly right. And that's where this qualitative data in the study is so powerful
Yeah.
because it gives a voice to all of those unique experiences.
Right.
And it forces us to look beyond just the numbers and acknowledge how different everybody is. There's such a diversity of needs and preferences within any group of patients. Doesn't matter how old they are.
That's such a good point.
Yeah.
It kind of brings us back to basics in a way, doesn't it?
Yeah.
Like, at the end of the day, healthcare, it really is about human connection.
Yeah.
And yeah, technology can definitely help with that in lots of ways, but it's not about like replacing humans altogether.
Right.
If anything, it feels like this study just shows how important that human touch still is.
It is. It's a key takeaway, especially for healthcare providers. When a doctor's trying to decide, okay, is telemedicine the right choice for this patient or should I see them in person? They really need to consider the individual.
Yeah.
Like, what are their needs? What are their preferences? How do they communicate best? What makes one person feel totally comfortable and understood might not be the right fit for someone else.
Totally. It's about meeting people where they are. And I mean that literally and figuratively. It takes, flexibility and open communication. Doctors really need to be willing to adapt.
Yeah, absolutely. Couldn't have said it better myself.
Yeah.
I think this research really highlights just how important it is to really think about telemedicine carefully, especially as it continues to grow and change.
This deep dive has given me a lot to think about. It
Yeah.
seems like telemedicine is definitely here to stay,
Yeah,
and it has so much potential to change how we access and experience healthcare.
for sure.
But as with any powerful tool, it's all about being thoughtful and intentional with it. And like you
Yeah.
said, keeping the patient's experience front and center, right?
Absolutely. And I think that brings us to a pretty interesting question for our listeners to ponder.
Ooh, I love a good thought-provoking question to wrap things up. What is it?
So, as telemedicine becomes even more integrated into our healthcare system, do you think we'll start seeing doctors who choose to specialize in virtual care?
Oh, wait.
Like doctors who really focus on developing those communication skills that are specifically for the digital world. They become experts in building rapport and trust through a screen.
That's such an interesting question. Like, will there be a whole set of skills and specializations that are specifically for virtual care? That is definitely something to keep an eye on. Well, on that note, I want to thank you so much for joining us for this deep dive into the world of telemedicine. It's been so fascinating to explore the intersection of technology, healthcare, and most importantly, the human element, that human connection really at the heart of it all.
It has been fascinating.
Until next time, everyone, keep those brains engaged and keep those questions coming.